Stay tuned, because in a few minutes you'll get a chance to win our case scenario grand prize giveaway, movie passes. All you have to do is pay attention to the case scenario, and during the question and answer portion at the end of the presentation, raise your hand and participate in the discussion. Every time you participate, your name will be entered into a drawing to win the case scenario grand prize giveaway, movie passes.
Here we go, yo! Here we go, yo! So what's the scenario?
The case scenario does get a little confusing, so you can use the worksheet that was provided by our ushers. You can raise your hand and participate as many times as you wish. Just like the nursing profession, there are no limits.
My name is Julia. I work at a large teaching hospital in a big city, and like many healthcare institutions, my hospital has been trying to cut costs by using more unlicensed assistant personnel. They usually float me to other units when they feel like it, and lately for some reason I've been getting a lot of foreign patients, and we all know that it takes longer to take care of these patients because of the language barrier. I normally get to work about 6:30 in the morning, and today when I got in, we were slammed. ER was calling all night to see if we had any beds for clients that had been there since the night before, and the other RN who's supposed to work today called in sick, and I'm sick too. So now it's just me, an LPN and 2 CNAs. Today we're taking care of 8 patients. 2 need to be ready for surgery, including a preoperative and postoperative teaching, one of whom is a 35-year-old scheduled for a modified radical mastectomy for the treatment of breast cancer. And by the way, when I went in to check on her, the CNA Maria was saying mean things to her. She said, "You're just a phony. You like being waited on, but that's not why you're here." And the patient started crying. I mean, Maria is pretty new, and she's a hard worker, but she is so mean to the patients. On a different occasion, a client didn't want to get out of bed, and she said, "Come on, you're so lazy. Get out of bed and move your big butt." We're really going to have to do something with Maria. So anyway, 3 of the other patients are second-day postoperative clients. 2 of whom require extensive dressing changes, are receiving IV antibiotics, and need to be ambulated. 1 postoperative client is required to remain on total bed rest, has a nasogastric tube to suction as well as a chest tube, is on TPN and lipids, needs a central venous catheter line change, has an IV, is taking multiple IV medication, and has a Foley catheter. 1 patient is ready for discharge and needs discharge instructions, and 1 client needs to be transferred to a subacute unit, and a report must be given to the RN of that unit. Once the client is transferred and the other one is discharged, the emergency department will be sending 2 more clients to our unit for admission. So you think you can handle a day like this? There's no way possible you can keep track of all of this from hearing at once. So use the handout we've given you as a worksheet to think this out and win those movie tickets. Good luck, everyone. Soon we'll be working side by side.
How should Julia organize her day? If you set up an hourly schedule of Julia's day, what would it look like? Stop film now for discussion. Here is an example of how Julia's day might look like. What type of client management approach should Julia consider in assigning staff appropriately? Stop film now for discussion. First, the RN must recognize the scope of practice for each staff member and what they are capable of. Utilizing staff members' capabilities creates a pleasant and productive working environment for everyone involved. Remember, the purpose of delegation is not, I repeat, not to assign tasks to others that you do not want to do yourself. When delegating to others effectively, you should have more time to perform the tasks that only a professional nurse is permitted to do. Do you remember Maria, the mean CNA? If you were the staff nurse working with Maria that day, how would you handle the situation? And what would happen if you ignored it? Stop film now for discussion. Maria should be taken to the side to privately discuss her actions. Maria should be informed that her bedside manner was inappropriate. If this situation was ignored, you, the RN, could possibly be held accountable. If you decided that you should not ignore the situation with Maria, with whom would you speak with? Why? And what would you say? Stop film now for discussion. The person that should be informed is the unit supervisor or charge nurse. This is to ensure that the chain of command is followed. Maria's actions and inappropriateness should be explained. By allowing Maria to continue to speak harshly to patients, we are allowing patients' rights to be taken away as well. Why do you think Maria speaks to clients this way? Stop film now for discussion. Maria may be frustrated with her job or job status at the hospital. She might feel that she has too much work to accomplish. She may have too many tasks delegated to her. The tasks that may be assigned to her may be unfair in that other CNAs are getting less work. And lastly, Maria may have overwhelming problems outside her work environment. If you were Julia, which clients and/or tasks would you assign to your staff? Stop film now for discussion. The unlicensed assistive personnel can be assigned vitals, ambulating patients, bed baths, changing bedding, emptying Foleys, and can transfer to the subacute unit with the LPN. The LPN can be assigned the dressing changes, medications, and transferring patients. Using the delegation decision-making grid, make staff and client assignments for Julia's day. Remember, this grid is a tool to help you delegate appropriately. It provides a scoring instrument for 7 categories that the nurse should consider when making delegation decisions. The scoring components helps the nurse evaluate the situations, the client's needs, and the healthcare personnel available to meet those needs. A low score on the grid indicates that the activity may be safely delegated to personnel other than the RN, and a high score indicates that delegation may not be advisable. Stop film now for discussion. Here is an example of how the delegation decision-making grid may look like for Julia's day.
Thank you for joining us. We'll see you next time here on Nursing Student News. Have a fun and safe preceptorship. Good luck and goodbye.